Hello, everyone. Today we are going to discuss a very important topic, which is road traffic accidents, through three main titles. First, the factors affecting or leading to road traffic accidents, different types of injuries, and the medical legal investigations. At the end of this session, if you have any questions, please write them down in the comments below. Let's begin with the factors leading to road traffic accidents. Uh, I summarize them in the word drive. D for driver's faults, road for faulty road engineering, and I for indicators and signs, their presence, and V for vehicle failure. And at the end, the environmental factors that may affect the vision and sliding of the car. So let's begin with the first and the most important one, which is the faults of drivers that are responsible for 85% of the accidents. The driver may be drunk, drugged, diseased, distracted, or driving fast. The second factors are related to the road engineering that may lead to bumpy roads and the bad lighting. The third factor is the presence of indicators and signs, especially the fluorescent indicators and road signs. The fluorescent indicators, particularly at night. Vehicular failure or failure of brakes, tires, and steering wheels. All these mechanical failures may lead to accidents. The environmental factors such as fog, rain, and snow also may lead to traffic accidents. Let's move to the different types of injuries that we can see in road traffic accidents. We have four main types of injuries: injuries of the pedestrians, injuries of the car occupants, and the pedal-cyclist injuries, and finally the motorcyclist injuries. Let's begin with the pedestrian injuries. There are three main types of injuries. Primary impact injuries, where the first side that come in contact with the car cause injuries, and we call them primary impact injuries. And there is a secondary impact injuries, when the pedestrian fell down and hit another object, like the floor, for example. This is called a secondary impact injuries. And finally, the running over injuries, when the pedestrian fall down and the car run over him. So this is running over injuries and causes what we call patterned injuries. This is an example of the bumper fracture. When the car hits the pedestrian from behind, the bumper of the car hits the cuff area or the posterior of the leg. This may cause severe injuries and lacerations up to fracture of tibia and fibula at this area, and we call it bumper fracture. This is common in children and elderly. This is another type of pedestrian injuries, which is the patterned contusions and abrasions. Here in the left photo, we can see that there is an imprint of the pattern of the car tire on the abdominal skin of the victim. This is another example of patterned injuries from a grill of a car, as seen here in the photo on the bottom left of the image. There is a metal grill that is imprinted on the side of the arm and the trunk of the victim. Let's move to the occupants with their different positions inside the car. We have the driver's seat, the front seat passenger, and the back seat passengers. Unrestrained drivers may be subjected to different types of injuries, while the front seat passengers are the most dangerous position inside the car, and it's also called the suicidal seat, as front seat passengers is not aware of an upcoming car, and he may be hit the windscreen and or ejected out of the car and may have severe head injuries. And finally, the backseat passengers may hit the back of the front seat passenger, may be ejected out of the car, hit the roof of the car. Here, the unrestrained driver, the lower part moves forwards and upwards, and the head may strike the windscreen glass, and the chest and the upper part of the abdomen hits the steering wheel, while the legs, knee and legs may hit the instrumental panel below, causing lower limb fractures and injuries. This is a whiplash injury that occurs when there is a sudden deceleration. For example, there is a strong extension of the neck followed by flexion. And this can cause severe injuries of the neck, even sprains or even rupture of the anterior longitudinal ligaments, and maybe even fracture of cervical vertebrae at locations. A Well, the force is transferred in cases of upper limb injuries up to the shoulder. In cases of the driver, by his firm fist over the steering wheel, and in case of the front seat passenger, by putting his hands on the dashboard. This force is transmitted back up to the shoulder, causing fractures at different areas. The uppercut. Well, this is a steering wheel impact on the chest. Actually, there may be abrasion or bruises on the outer skin may be absent in such cases, while internal injuries can be present. In other cases, we can see the lower rim of the steering wheel imprinted on the lower part of the chest or the upper part of the abdomen. This is the impact of knee against the dashboard. Um, The force is transmitted backwards, may cause fracture of shaft of femur, neck of femur, or if the femur is adducted, there is maybe a posterior dislocation of the hip joint. This is an example of sparrow feet lacerations that may be caused by the cube-shaped fragments of the tempered glass, causing small linear angulated injuries, usually in the face and neck, but maybe may occur at anywhere in the body, exposed skin. So the sparrow feet lacerations nowadays is less than previously, as they use now laminated glass in manufacturing cars. Although the seat belt is very important in keeping the occupants inside the car and prevent them from the forward movement against the windscreen glass or the steering wheel or whatsoever, uh, it has some disadvantages. As we see here in the photo, there is a diagonal abraded contusions across the chest and abdomen, and also here down the photo, there is a horizontal contusion along the waistline. This was clearly a right-sided belted passenger. In special situations, like if there is a pregnant female, well, the seatbelt may cause rupture of uterus. In cases of children below 13 years or small-sized female, for example, below 36 kilograms, they may slide down the diagonal part of the seat belt may actually strangulate their neck. And this is very dangerous things that may occur at the accidents. Sometimes these abrasions and lacerations may be in the internal organs as well, and mesenteric lacerations can occur even spinal dislocation may occur, especially at the lumbar area. Let's move to the pedal-cyclist injuries. There are primary impact injuries, usually on the legs, but less than those of the motorcyclist injuries. And the secondary impact injuries anywhere in the body. Head injury is common, but here there is a particular type of injury, which is a stripping of the skin of the leg, particularly in small children or in the children when their legs is forced between the spokes of the wheels, because then this is stripping of skin. And finally, the motorcyclist injuries. Actually, the injury and death are higher than among car drivers here because the age of the rider here, the driver is between 16 and 24 years. The primary impact here usually the legs, and the secondary impacts anywhere on the body. But the head injury here is very common, and there is a very characteristic type of fracture, which is motorcyclist fracture, which is a basal fracture of the skull. Let's take a look at the motorcyclist fracture. It's called a hinge fracture as it separates the base of the skull into two halves. Actually, it may be an extension of the fissured fracture from the vault of skull, extending to the base of the skull, separating it into two halves, hence called hinge fracture. Um, There are different safety measures, like using helmets to protect the head from these head injuries, and the crash bars, as we can see here in the photo, that protects the legs, and it covers the engine and projects at both sides, thus protecting the legs. Actually, when the motorcycle fell down, there may be the engine may come in contact with the ground, causing it to burn and explosion kind of care. And here we can see a mix between physical and injuries, thermal injuries, and mechanical injuries on the victim. And now we are going to discuss the medical legal investigations of drivers, victim, and the vehicle itself. And let's go to the driver investigations. Here we have to investigate the role played by the blood level of alcohol of the driver, if he was drunk or not, and drugs taken before he drive, like barbiturates, tranquilizer, or even he may have taken hallucinogens. And the deceased driver may be a cause of an accident, like in cases of severe chest pain, like angina, in cases of ischemic heart disease, or sudden rise of blood pressure because of severe headache or blurring of vision, and of course, epilepsy. Here we have to keep in mind that accidents may be a method of masking homicide, so that must be kept in mind. The examination or investigation of the victim. Well, the pattern of injuries and position of the victim must be investigated, his position when struck, and his final position as well, and the role played by natural disease in the outcome of the accident. As well, the victim may have a predisposed heart, chronic ischemic heart disease, or maybe coronary thrombosis is discovered in the autopsy, or cerebrovascular accidents, and maybe the accident only an associated factor, or even we can say a provoking factor due to the stress, but actually it is not the main cause of death in that cases. So we have to in the outcome or the fatal outcome. The accident may be a method of self-destruction or suicide, and that's also have to be kept in mind. And finally, the examination or investigation of the vehicle. The vehicle have to be examined regarding any physical evidence like marks from contact with a pedestrian, blood-stained fibers, or hair, and the mechanical failures of tires, brakes, or steering wheels, or whatever, and the final position of the car itself. The reconstruction of an accident is a complex task, and usually experimental tests have been carried out using dummies. Thanks for being such attentive audience. And if you have any questions, please don't hesitate to write them in the comments below and I'll answer them. Thank you.